You can see I'm just pinching frequently people have what's called underboob, that little fullness under the breast, so we're gonna work on that. And I always show my markings to the patient so they know what they're getting into, kind of. They awake for the procedure, so they're in control. We frequently look together and make sure we achieved what we wanted there. So marking this. Sometimes people have a little crease that I try to break up with my suction cannula. So our pokes for the suction, we're going to keep them very low, so when the patient wears her normal underwear, they're going to be hidden. And there's one on the belly button that's also hidden as well. So this is kind of where I'm planning to do my pokes. And then we'll work on her flanks, waist area as well. Right now we're doing just sterile draping. We keep this procedure sterile, even though, because the openings are so little, the chances of infection are pretty low. We sterilely prep the skin. It kind of depends on the frequently what I've noticed on the background. So we're using this tiny little needle to numb up the area, just infiltrate the insertion sites. We calculated the maximum amount of lidocaine we can give safely to the patient. We'll make sure we have all the equipment ready. The next step is to create little skin openings. Again, one is hidden in the belly button, and the other ones are very low. Patient doesn't feel that because we numbed her up. And this creates a tiny 2 millimeter little openings in the skin. So we can insert our cannula. And cannula is this hollow metal tube, looks like a little straw, and it gently goes under the skin and allows us to infiltrate the tumescent solution. We use a special pump, so we're setting up the speed of the pump. So the fluid is going under the skin and gently infiltrating. The patient is not feeling much. She got pre-medicated with our special mix of medications, non-narcotics. Helps you to relax, and also we have a Pronox, which is a half and half mixture of a laughing gas, nitrous oxide, with oxygen. So the patient takes the tube and she breathes in, and it helps her to take the mind off. So this is that Pronox. This is the basically mixer of nitrous gas, laughing gas, and the oxygen. There are 2 tanks attached to it, and you can see the tanks, and the patient just holds the tube, and it's like going snorkeling. I'm infiltrating the patient's stomach. She's very comfy. We always measure how much we put in each quadrant on each side, so everything stays symmetrical. A lot of it is done by feel, so I feel how tight the skin gets, because the idea is to put usually several cc's of that numbing solution per each cc of fat that we're planning to take out. That's why it's called tumescent technique for liposuction. And usually I warn the patient that the pinchiest areas, the spiciest areas, usually around the ribs. But we still want to suction in that area because frequently people have little fat deposits there. Usually still very well tolerated, especially with the laughing gas. And once this is all numbed up, then the patient doesn't feel much. And you can see this area is getting full of fluid, so this side of the stomach. The other area is not so, so this is tight. This is what I want. That little pressure that we build. It helps for the local anesthetic to go into the tissues to numb her up. Also helps us to extract the fat. The solution contains lidocaine, epinephrine, and tranexamic acid. Epinephrine is adrenaline that shrinks the vessels. Lidocaine is a local anesthetic that numbs you up, similar to what you get when you go to a dentist. We record on the board how much we put on each quadrant or each quarter of the stomach. And again, we're trying to keep it very symmetrical, so same amount goes on each side. So when we take the fat out with the fluid, we take out the similar amount. I still go by feel, but it also helps me to stay symmetrical. Keep injecting until we numbed up the whole area, we infiltrated the whole area. So the patient, you can see, it turned a little pale because that epinephrine makes the vessels shrink. And she should be very numb here. So the next step will be the actual suctioning. So we're gonna pick the cannula. I'm gonna use the curved one. So we have different sizes, different styles. This is a 5mm curved flared Mercedes. So it helps me to work nicely around the ribs because you can inadvertently slide under the ribs, and then you have important structures such as your lungs there. So obviously we want to avoid any injury to the deeper structures. We want to stay under the skin. So that curved cannula will work great first, and then sometimes I turn it, and this way I can reach all the way around the flanks to improve that waistline. So we're going to attach it to our power suction, not to our suction machine, but also to the power assisted handpiece. And the reason it's power assisted, it vibrates. There's a little electric motor that it's attached to that makes it vibrate and oscillate very fast. So it helps to extract the fat, just like an electric toothbrush, helps to extract the fat more efficiently. So here's the difference. If I pinch you here, that's quite a bit for sure. And then if we pinch here, that's what we get. So this versus this. So obviously we gotta leave the skin behind and a thin layer of fat, but you can, this is much fuller, this is much flatter. Maybe from the side you can show it better. Still staying smooth. So the patient is on her stomach now. We actually ask her to move, and she's doing great. She had several sips of water. Sometimes patients ask for a little drink because their mouth gets dry from that Pronox gas. So she had a couple of sips, otherwise she's doing good. How are you doing there? Good. She's doing good. So she's not feeling much. So the advantage of the patient being awake, that you can talk to them and you can ask them to position themselves a certain way, so you can work every corner kind of. So we will just continue. So we are done. This is immediate on-table result, and you can see even with the fluid and with the swelling up there, this is already a great difference. You can see we didn't do anything with the buttocks. We didn't put any fat in the buttocks whatsoever, but that buttock looks much rounder and perkier because we really worked on her lower back and the waist area, sectioned this out, so the buttocks look much more appealing.